People tend to have this mindset that I've seen of things are on the edge of collapse right now. I'm not saying that's not true, but guess what's also true? It's always been that way. The people who take it back from the edge of collapse are the people who have hope. If you want to make a difference in a world that looks like it's on the edge of collapse, then be a person of hope. Don't keep pushing it towards the edge.
Whether it's in the country of getting the latte or looking for your next drink of water, we all have the tool to make that change, right? And I go back to that again. It's up to us to make that decision, whether it's to make a change in your career or in your business or in your spiritual relationship. When you start dreaming and visualizing it and taking those small steps, man, it's amazing what we could do. And you're right. People like us are the ones that are going to have to take us off of that edge of collapse.
Welcome to the Care We Need podcast, where we bring together patients and providers to explore how we can improve U.S. health, wellness, and human services systems. This podcast is brought to you by Bennis Companies, where we provide education, consulting, technology, and other resources to help health and wellness professionals streamline their systems, enhance their collaboration, and deliver better health outcomes for their clients. With us today is Ty Gipson, a survivor of multiple major surgeries and organ transplants, who now advocates for organ donation and patient awareness. Drawing from lived experience, he speaks on the role of mindset, resilience, and hope in recovery, grounded in science and practical experience rather than simple platitudes. His work offers a grounded perspective on how psychological and behavioral factors can meaningfully support medical care in complex health journeys. Let's go.
Brett, thank you for allowing me to be here. But I want to really jump in on kind of, you asked about my mission, and I love talking about it because I get very passionate about life experiences. Has really brought me to my passion, as we all talk about. Your purpose is kind of what we have to help others, and I have life experiences. I tell people all the time, I don't have the PhD in this, but I do have a PhD in life experience, and that's created my passion for this. I'm a recipient I've had 3 transplants, and so organ donation has been like life-changing for me, obviously. I've received multiple organs, and I've been through a lot of healthcare, challenges. But so my passion and my goal in this is to try to help people really through whatever adversity they're dealing with. A lot of times it's medical. It may be anything, but really what got this bread, I'll tell you how it started is real quick is my wife. I grew up in an area where my dad was one of those told me just to dust off and keep going kind of thing, right? In that era, nobody wants to hear your problems. So I kind of always held this in. I just, always and at the time I didn't like that, but I'm very thankful for it now because I feel like that prepared me for what my journey ahead was. Right. And so I told my wife several years back, asked me if I would tell the story at a extended family reunion. And I told my story, I told her, I said, if they want to hear my problems kind of thing, I'll be glad to share it. And I did. And on the way home, I got like 4 or 5 texts from just extended family members saying, hey, thanks for sharing, that I'm going to go sign up to be organ donors after hearing your story. And I thought, how selfish am I if I can simply tell my story and help others? And that's really where it kind of started my passion on organ donation. And so now I go around, I speak, I do public speaking, I got a podcast, but my passion is organ donation and trying to help people through that.
Wow. So it started very organically. It sounds like it started with you just sharing with the people in your life at the request of your wife. You realized that this is actually something that has an impact. This is sharing your story isn't just something that is, I'm not complaining. This is actually making an impact on other people. And people started signing up. And so that led to you starting to do this more professionally?
Absolutely. And what it did was, after one of my organ transplants, I was able, because someone made an organ donation, I was able to get married, start a business, adopt my second daughter. And I always said, man, because of that, someone making that organ donation decision in a horrible situation, right? The tragic situation, the small little glitter of hope was to donate their organs, and it saved my life. But because of that, I was able to do these things, and it just, I was able to, that business that I started 20 something years ago, this past year, we sold, 45 plus employees, and a company came along and wanted it. And you know what? After we did that, because I asked my wife, I said, what am I going to do? She said, I know exactly what you're going to do, because every time I was laying on that bed and wondering if I was going to get through these medical situations, and if I was going to get through it, get out of the hospital, if the meds weren't going to kill me or whatever, I always said, just get me through this, good Lord, and I'll do whatever I got to do to help. And that was one of the things. This is now what I do to try to help.
And so was that company related at all to this mission, or was that more of something that ended up facilitating it?
It was not. It was just a facility. I mean, it was my passion. I worked early on. I was a Disney employee. I worked years ago at Disney in the graphics marketing area, and intern, and then I stayed on. But I'm a graphics background guy, right? So I love graphics. I love sports. But I was able to bring the two together and start a company that does graphics inside of athletic stadiums. But it wasn't related to my mission, but again, it gave me the vehicle to be able to do it and sell it. And I still work with the company. I just in a different role that gave me a lot of time, a lot more time to be able to work on my mission.
So from there, you started getting speaking gigs and you started sharing your story.
Absolutely. And it's, at first I thought I was still in that mode of, man, does anybody want to hear my story? But what I've realized is there's so many of us out there dealing with adversity. I've had people that I went to college with and high school with, and my seventh grade football coach of all, years ago reached out. They've reached out to me over this time and said, hey, thanks. I really needed to hear that. So, my goal is if I can help one, Brett, I'm achieving my goal, right? Again, it's just a hard, we live in a hard world. It's tough. We talk about, you and I are just talking about different things, but from relationships to whatever it is, your goals, your purpose, all these things. We're dealing with, like medically, a lot of us are, it's hard. It's hard dealing with just trying to maintain what we do. When I got out of the hospital, my first time with, my transplant, I was taking 65 pills a day. Guys, think about that for a minute, right? Just trying to keep up with medication. It was a full-time job trying to keep up with medication. And did I get this? Did we order it in time? Is there a renewal? Can I get it refilled? Dealing with insurance was just like trying to pull my hair out, right? And to this day, I still take 35 pills a day. And so that is a challenge in itself. But what I want to say is, I'm not here to tell you all my challenges. But what I want to say, what I'm trying to teach and what I'm saying is, on the other side of these challenges are some amazing things. So I want to encourage people. And that's really my goal, Brett, is to encourage people through whatever it is. Because we can sit here all day. You and I we could talk medical and insurance, all these problems, but really we all have them. But what I want to talk about is, man, push through, because on the other side is we've got family, your why, right? Your family, whatever that is for you. Focus on your why, because that's what really helps push us through that.
We'll get back to that conversation in just a minute. Right now, I want to let you know about two powerful keynote speeches that Ty Gipson is offering. One to help care organizations improve their systems, and one to help empower the people navigating complex illnesses within them. Her first talk, Win the War on Complex Illness, comes straight from the battlefield. As an intelligence officer in the United States Army, Ty took the worst performing brigade in her area of operations and helped turn it to the best, using a framework she calls the 4 steps to winning a war. Now, she brings that framework to health, wellness, and human services organizations so they can improve complex illness outcomes without rebuilding from scratch. Her second talk, Heal or Die, is deeply personal. Ty spent years battling complex PTSD, chronic fatigue, depression, anxiety, and suicidal ideation. Today, she's thriving as a wife, mother, author, and entrepreneur. In this keynote, she shares the mindset and lessons that helped her take back her power, reclaim her life, and achieve real results despite disintegrated health, wellness, and human services systems in the United States. This talk is perfect for veteran groups, patient and caregiver associations, elder care groups, and civic organizations. Visit tybenes.com/speaker to learn more or to book Ty for your next event. All right, back to it. Yeah, I'm reminded of the book by Viktor Frankl talking about when he was in the concentration camps in Germany during the Holocaust. And one of the things that he used to do, I've shared this story before in the podcast, but he used to go around and just touch bases with the people that are around him in the camp and just say, like, hey, who's waiting for you back home? Or what project were you working on that is unfinished, that'll be waiting for you when you get home, or just stuff like that. And remind people that there's something beyond this. There's a reason to survive. There's a reason to keep going. And one of my personal definitions for the word hope is a commitment to pursuing the best possible outcome in any situation.
So true.
And it sounds like a very similar thing for you, of like, there's a reason to get through this, and there's people waiting for you on the other side. Regardless of what happens now, there's some good that can come of this. And I wanted to touch on your comment a couple times about like sharing your problems or talking about what you've dealt with. And my wife and I were just sharing a little bit ago how the culture in America, there's a couple different things that we tend to deal with. One is we have a chronic fear of being an inconvenience to anyone. And it feels like, especially if you come from a little bit of the old guard, where it's like, no, I'm as a man, like, I'm here, I handle my own problems. I don't ask for help, I help, that sort of thing. She was talking about how it takes away the chance for community. It takes away the opportunity for community. I think it was Benjamin Franklin who offered the advice, when you move to a new neighborhood, go next door. And, well, I think I'm paraphrasing his story a little bit, but he used to always ask one of his neighbors or one of his rivals for a book. Like, he would borrow a book, then like he would read the book or whatever, but he would return it, and it would always be in the back of his neighbor or his rival or whoever he was trying to connect. It was always be in the back of his mind that like they did him a favor, and like he owed them a little bit, but it set them up to be very amenable to
Sure.
building a relationship. And so in a way, you're tapping into that, but you're also using that to inspire, hey, there are things you can do to help, both building community, but also helping those people who need it.
And that's so true. And I'm glad you said that, because, again, as I bring up, we live in a world that, I mean, we need to be able to share our stories. Everybody has a story, and that's something I realized. And it's kind of opened my eyes to a lot. It's something similar, like maybe you and your wife's conversation was, why are we being so guarded with what we're dealing with? Because what I realize is I could be helping others, and this man thing of, you're like she mentioned, like, oh, we're supposed to be the help, not the, asking for help. And I truly agree with that. I think it's, we need to lock arms and put our arms around each other and try to figure out how to get through this together, solo. If you don't mind, you mentioned hope, and I want to bring this up. People ask me, Ty, how did you get through a lot what you went through, right? The multiple transplants, the juvenile diabetes, and all these things at a young age that I have battled all my life. And there's 3 steps. And the first one I always talk about is when I look at an obstacle, and I hope people can use this. I hope this may be something people can take away. But the 3 steps is, number 1 is grow or die. It kind of goes back to what you mentioned a while ago. Are we going to get better? Are we going to when I say die, I don't mean death necessarily. I mean a death of your dream, your purpose, your project, as you were talking about, right? Are we going to stay focused on that? Don't let those die. And then number 2, you mentioned hope or despair. I mean, are we going to stay positive? Just to phrase it, a positive thinker. Don't be a victimized. Why did I get picked to have 3 transplants? And why did I have juvenile diabetes? Don't start that, because what happens is you start to think that way. And then number 3 was humor or drama. And to me, that's how we talk, right? I'm going to rephrase this. Grow or die is what we do. Hope or despair is how we think. And then humor or drama is how we talk. And if we do those 3 things, guess what? We become a positive thinker, and our mind is a powerful thing. And I hate using the word, hey, be a positive thinker. Well, what does that mean? So these are 3 small little steps that just kind of force you into being a positive thinker. So I hope that works for somebody as it does for me. When I wake up and I'm all I went through every day, to me, I wake up every day's a bonus day to me. I'm excited just to be here. But I'm also facing adversity too, just like everybody else. And I use these things to help me through those.
That's interesting. Thank you for sharing those. I'm sure our viewers will be able to take that and run with it. It reminds me of 2 things. One, it reminds me of, there's a phrase, I think it originates in the Christian scriptures of Proverbs, where it talks about, as I think, therefore I am. It's been reused and repackaged many times since, but the idea that starting with changing your thinking and then it moving into acting, and then it becoming more of a way of being. In a way, you could say that, am I going to be humorous about this? Am I going to be or drama filled about this? And the idea of setting yourself up, here's how do you break that as I think, therefore I am, into actionable steps. Let's first fix what I'm going to focus on. Let's first fix what I'm going to do about it. And then how am I going to be about this business? And the other thing it actually reminds me of, I'm glad, I think I introduced you to my wife via email, but I would love to hear a conversation between you two, because the book that she just produced of her own complex illness healing journey is entitled Heal or Die, because for her it was a very real question, and people who are interested in that story should go get the book. It's a riveting read, but it started with that question because she started on a bed 23 hours a day, couldn't get out of bed, that sort of thing. And it's like, well, either I heal or we're done. And it sounds like you two had a very similar approach to this, and like, let's go, because otherwise the option's the other way.
And I do say that, and I'm anxious to hear. I'm really interested now in getting your wife's book. That sounds like an amazing story, because I love that, because it cost us zero. We have the tools. Each one of us have the tools that we need right now to face adversity or whatever it is we're dealing with. As your wife did, she had to make a choice. She looked herself in the mirror and said, "That this is my choice," right? And I believe that with all of our adversity, we have what we need, and that's my mind, right? So look yourself in the mirror and make a choice, whether you're going to grow or die, hope or despair, humor, drama. That, because we can do it. It's on our own. It doesn't cost us a dime. We have the tools, and I mean, there are stats out there that prove, and it's not just me talking a feel good, motivational speaking type guy. There are true stats talking about positive thinking and what it does for our progress and our success. And so I'm really anxious to read your wife's book. So I love stuff like that. And I love stories, because I mean, just a brief glimpse of mine, because on the other side, because we make that decision on the other side, as I talked about, there's some really good things. I had the choice. I was going in for a surgery back early on, there was 4 people that had this surgery. 2 of them, it didn't work, but I had to walk out of that house that morning to go to surgery with a 6-year-old at home. And I did not know if I was coming back. I did not know if I would ever see her again.
I have a 5-year-old at home right now, so I can feel that.
Yeah. I mean, so when I got the call in the middle of the night to get to Baltimore for this surgery, I had to make a choice. And that's why that's where the no options mindset comes in that I talk about, because I had no options. I can go on dialysis and live maybe not a real quality of life, but I would live a little bit longer. But this surgery could progress my life for years. And I got through the surgery and everything was fine. But here's the beauty of that. And I talk about the other side of adversity. Last month, I was able to walk that 6-year-old that I walked out of that house for down the aisle and get married. I always want to say there's beauty on the other side of this adversity.
That's amazing. And that especially, I think, provides a clue to how to hope in the middle of this, because it's again, I keep relating to my wife, but you and she have a lot in common. Something that she has mentioned before is how she has battled some of the anxiety that has come from her own struggles as it relates to being a mother, and how she has been able to move forward and try again and keep going and not be kind of crippled by anxiety about how things are going to turn out, sort of thing, is she imagines our daughter thriving 15 years from now. Like, she imagines what that feels like and what that looks like. And she puts herself there and just watches in her mind's eye, experiencing something like what you just said. And that you yourself, like, you've experienced it. My wife is on, and I are on the other side of it, where we're like, we're looking ahead to that. But those type of things are what set your heart in hope. They're the things that like ground your heart in hope, and really connecting with those. So for those who perhaps haven't done this or who are struggling right now, that would be a really good practice just to start with. Imagine your life, your kids, or whoever 15 years from now, thriving and doing beautifully, and connect with that future, connect with that vision of the future. One of the things that I learned, I was a martial artist for several years, and I still am, but I wrestled for several years. And one of the things that I learned about that really kind of ties back in with your 3 steps to hope, if I may call them that, is the idea that in wrestling, whenever you're maneuvering, whenever you're fighting, whenever you're doing stuff, your body will follow your eyes wherever you go. If you are driving into someone and you're trying to do something, if you look where you're wanting to go, like, your body will follow and all of your muscles will align to push yourself in that direction, and you'll be able to take your opponent that way. And the same is true in life. And I've seen it so much in people, in myself, when I look to the darkness, when I look to the shadow, when I my entire body, it's like it's listening to my eyes, like, okay, this is where we're going. And everything starts to change and feel like everything is going in that direction. But when I do the opposite and look towards the light, my whole body shifts, my entire life follows, and I start moving towards the light. It sounds like it's very similar to what your 3
And
steps are.
it is, it really is. And man, that's a great analogy. I love that. I wasn't a wrestler, so, but I mean, I could see where that really makes a lot of sense. And we've all heard the 1% each day, you know, but you also think about that, and I'm doing a little bit of a study right now on some of this, dive into this positive thinking and the scientific side of it, right? But if we simply think about that 1%, and we project 1%, and we're not going to, it's kind of like lifting weights. You don't go lift weights and think, come back in and go, look how good, good I feel. You don't notice it, right? But if you do it over time, you start to see results. And it's the same thing with our mind. If you do if we got to work out our mind that little bit each day, and you're not going to come back and go, man, I'm a positive thinker. But do little steps each day. And before you know it, you're really training your mind to be a positive thinker. And it's amazing over time, as you become doing this from small steps, how your mind now shifts to just being positive, right? And again, you're working out your mind, but find something positive each day, something that's shooting towards your goal, or your mission, like you guys, in your case, your business, right? Find that thing that's driving you a little bit each day, because think about it just the other way. If you're doing things that's not, over time, you're going to get where it's just a harder hole to get out of, right? And that wall seems bigger, and your brain is trained to be a negative thinker. Just as much as you can train it to be a positive thinker, you can train it to be a negative thinker. Now, the old phrase, you can't teach an old dog new tricks, is not true. You can retrain your brain. It's just a lot harder and takes a little bit more time as you let it get down into the negative side of it. So that thing is very intriguing to me. It's about the positive thinking and all that, because I really, at the time I wasn't thinking about it, but when you really look back on it, and when I really dive into my situation, it was up to me. It was up to me, and I'm a faith driven guy. And I believe, I truly believe that there was a hand in it. We have a plan, right? But we've got to be we've got to be someone that's working. And the phrase I hear people all the time say, man, they're always so lucky. They did this, and they did. I can promise you this: people that you see that are successful, that you say are lucky, behind that lucky is a lot of hard work. Behind people that just things fall in their quote unquote fall in their lap, they're doing a lot of work behind the scenes to get there. So for you to get to the next step, to get out of this negativity, we've got to keep putting the work in. And that's small steps every day to get better.
Yeah. Training your brain, like you said, training your brain to think of it in that way. If you could dig into a little bit of the science behind some of what you're talking about, you've mentioned it a few times, and I would love to hear and learn from you, just understand the science behind the principle, so to speak, of the positive thinking and committing to hope and that sort of thing. Like, what have you seen in the scientific literature?
Well, there's a lot out there too. I mean, like I've said, I'm diving into it pretty heavy right now, but it's just, my fear early on was I didn't want to just be a motivational speaker, right? That's not my goal. My goal was I want to be authentic and fact driven, because I can talk from a life experience, but I've also really enjoyed this, really getting into the the depth of the way our brain works. And I wanted to what's been really interesting to me is as I talked about, over 80 million of these we build. I guess the best thing is we're continuing to work our brain. We get so many tools for all our other body, right? We talk about all the tools for this and that, but we don't focus on our personal health as much as we should. And when I say personal health, it's funny. I was just on a deal the other day and they're talking about personal health and the spas, and that's not personal health, right? I mean, the massages, the spas, and all that. What I'm talking about here is the mental state and mental health, right? And what I have, me personally, a couple of things that I do that is new is meditation. I what I've read and what we're learning is we need to make time for our own mental health. And from that, what I say is there's so much data out there talking about the mental health side of our, and I'm not talking about a lot, but I start the morning off every day in a quiet place. Me personally, as I said, I'm faith. I say my prayers. I talk about my goals. I envision my goals, right? And that's some of the stats that some of the depth of this mind is not only thinking about what you want to do, visualizing what you want to achieve. If you can visualize what you want to see and where you want to go, your mind starts to build patterns and routes to that. So that's the old theory of like the car that you want to buy, you put it on the refrigerator, right? But in our mind, we need to think each day of what is our goal today? What does that look like? And you really visualize it. How's this going to happen? What is this going to look like? What do I hope? Now, it doesn't always work that way, but what happens is you start to create paths mentally to achieve that goal. So, from that, I would just say, I don't want to overwhelm, but just a small bite would be each day to take a mental break, whether you can do it in the mornings. Everybody's schedules are a little different. Some may like it at night, but what does that day look like? What does your dream look like? Visualize it. Don't just think about it. I want to do this. I want to do that. Dive deeper into that because your mental state needs to see it, not just talk about it. Don't just put it on paper, put it visually.
We'll get back to that conversation in just a minute, but we have some exciting news to share. If you or someone you love has ever struggled to find the right provider for a complex illness, or if you're a provider that is tired of spending thousands of dollars getting new clients in the door just to find out they're not a good fit for your practice, then this one's for you. 194 million adults and 22 million children suffer from complex illness in the United States, causing over 80% of all American deaths. This isn't the fault of the patients or the providers, but the disintegrated system in which they live and work. Our research found that patients have to try up to 17 different providers and spend up to $50,000, with fewer than 20% of those actually getting cured. On the other side, most providers have to spend around $800 to get each new client in the door, and then have to waste precious hours screening, intaking, and diagnosing that client, just to find out the client is not a good fit for their practice. Now everyone has to start all over again, driving up costs and driving down. Bennis Companies is getting ready to change this. We're launching The Care We Need, a new platform designed to streamline that process for clients and providers alike. The client will be able to enter their symptoms once in one place from the comfort of their own home. The platform will then assess their information and match them up with a number of relevant providers in their area and at their price point. The providers will then receive a warm handoff with pre-screened clients committed to their programs, intake data already collected and ready in hand. This may sound like a lot, but I promise you it's only the beginning of what this platform will offer. Go to benniscompanies.com to sign up for our newsletter, be the first to know about user testing opportunities, or donate to support this cause. As always, like, subscribe, and send this episode to someone who would benefit from it. All right, back to it. And there's a couple things as well that I want to bring in, even if some of the viewers may not be predisposed towards a more religious or spiritual view to support this. There's so many things, like you said, there are very solid reasons why this works, why hope works, why visualizing works, why as I think, therefore I am works. And one of them, just looking at a neurological point of view, that the things that you envision, the body cannot tell, as far as I have understood from a layman's research, the body cannot tell the difference between something you visualize and something you experience. It's receiving the stimuli either way. And so as you begin to visualize, experience all of those things, you literally kind of rewrite your brain to be prepared to experience that sort of thing. And the other thing that happens, you prepare yourself, you begin to be aware of things like opportunities that you wouldn't have been aware of. But then also sociologically, people tend to treat you like you treat yourself. And when you, for example, for pulling from my own background or whatever, when I visualize myself as someone who's a CEO or someone who's like a future leader and all this stuff, and I think of myself that way, I begin to act that way, and people begin to respond to me as if I am that. And it's something that it's in and of itself, it prepares you. But then when you conduct yourself in that way, opportunities start coming. People start looking to you. In the case of if you visualize yourself as a leader, or whatever, people start to look to you in that way, and then it becomes, in a way, a kind of a self-fulfilling prophecy. Whether you look at this as spiritual, or whether you look at it purely neurological, psychological, all that stuff, like, it works either way. However you look at it, it works. And so tapping into that, if no matter where you look, you see evidence that this principle works, it's probably something worth looking into.
That's
and
right.
worth trying. And I'd like to tie this in a little bit more to your personal story again, where one of the things that I have seen a lot, and I have seen the people that I have helped, the people that we have helped a lot, is the way that the healthcare system, the health, wellness, and human services systems are set up in the United States. It's very fragmented and very difficult to navigate as a patient, but especially as a patient with a complex illness or a complex healing journey it sounds like you have had. I want to understand a little bit more of what your experience was navigating that system, but also how this mentality helped you break through the barriers, overcome the gaps, and come through to the other side.
Well, that's a great question, Brett. And I tell you, I think you really need to be equip yourself with these tools before you try to face the healthcare system, because it does have its challenges. I first and foremost, there's been some amazing doctors of medical help throughout my journey. And I give credit to a lot. I mean, it's amazing technology and doctors and people. The system has been very challenging over the years. I mean, I'm going back, my first, when I got diagnosed with diabetes was in the late 70s. So I'm going to age myself here, bro. It was in the late 70s. And I mean, there was a lot of different things there, the way it worked. So I've seen, and I've been deeply involved with the the care and the system for years, from the 70s and still currently. I was telling you earlier, I mean, I got out of my first transplant taking 65 pills a day. And it was not, I mean, it was multiples of different types of pills, right? So I mean, trying to keep up with all of that, and I still to this day take over 30 pills a day. But so I'm constantly learning how the medical system works. And it's very frustrating. Every year we switch insurance now, and I mean, it's been very hard because I mean, every time I've got to be really careful. And I think part of owning the company was helpful, because I could really select what insurance policy. Now that we've been bought out and it's a bigger company, I've got to be really careful of what we're looking at. So for the lack of a better word, it's been very, very tough. We spend hours every month just trying to make sure everything's taken care of, and the meds are ordered. And because, as you know, when insurance changes, it, especially this time of year, some of your suppliers do not accept the insurance that you're on, and so on and so on. So that's been a very challenging thing. But then again, I just, the systems, the U.S. medical system, I've got a lot of hope that they're going to continue to work on that and get better, and that's all I pray every day that that's something that is being worked on. I know there's a lot of people working on it, and if we could just get some of the politics out of it, maybe we could get there. But that's a big hope. But I hope we can get there. And I spend a lot of time. My wife and I spend a lot of time just trying to navigate our systems every day.
And I would agree. It's not typically the providers, the professionals themselves. Most of those are very professional, very well-meaning. They got into healthcare, they got into wellness for a reason, because they care about helping people and making an impact. But it's the ecosystem, the system itself, where People don't typically work with people outside of their immediate area of expertise. And then the insurance systems tend to be very kind of segregated and locked into a certain type of care. And I know in the military, we dealt with that a lot, where even the methods of care, even the mindset behind care tends to be far behind what the civilian sector is. And it's not that, I want to be clear about this, whether it be military or US healthcare in general, what it does well, it does really well. And what it does well typically is acute single point of failure issues. My arm is broken. Something needs to be cut. Something needs to be sewn. Something needs to be fixed. It's what I would consider, as a former soldier, is battlefield medicine. Like, this will get you to the next day, and this will prevent you from dying. But then I think we're at a place in the country, in the culture, in our technological level, where we can start kind of lifting our eyes to the horizon a little bit more and saying, okay, what's beyond survival? How do we move from keeping people from dying to helping them thrive, and being able to cope with complex illnesses, complex issues is a really big part of that. And like your story, having to deal with those multiple surgeries and dealing with these 60 pills a day, and you've really experienced the insurance side of things, and being able to learn how to navigate a very well-meaning but disintegrated system. And I want to learn more from you about, one, how have you done that? And two, how have you maintained your hope as you did it?
Well, and again, it goes back to a mindset, because first of all, it's frustrating. Again, and I'm also wear an insulin pump. I wear a CGM, and you're constantly having to order new supplies and this and that and that. I can't order more than this, and so it just creates this huge frustration. And so my wife and I have learned to understand this is not going to be easy. Because there were days and nights where we're like, what do we do? There were times I didn't know if I was going to get insulin in time before I ran out of insulin. And as a diabetic, you can't do that, right? And so there were times of things like that were really stressful. But we have learned over time about when we can do it, trying to get, you got to learn the systems. But like I said, they change. A lot of this stuff changes every year. They're moving the goalposts all the time, right? And it's just things that we did last month that we don't need to do this month, or this last year now changes. So that's the challenging part of it. But I'll tell you, we go through every Sunday night is my medicine night. I do, I sort out, my wife and I sort out meds on Sunday. We're looking at what needs to be ordered, where are we at as far as supplies. We're constantly managing. It's a full-blown managing thing to make sure you've got everything you need. This is our last refill of this med, right? So we got to make sure, there's a lot of that. It's not as simple as, just being on an online where it just reorders, because those refills are out and then they just don't show up. And then you're set yourself in a bind. So a lot of these meds that I take are anti-rejection medications because of a transplant. So it's not stuff that I can take a day or two off, because it really throws off some things. So it's it's a full-time job. But again, it goes back, I think, to a mindset a little bit too. You got to have the right mindset going into this medical, which is what we're talking about, right? And I think part of that has helped me, again, just to realize hope and all these things, right? You got to have the right mindset going into it, but you also need processes. At the end of the day, you need to make sure you have a process, because if you don't, in today's systems and the way they work, it can be really an incredible nightmare, but it also, just from a health standpoint, can be really serious challenges. So I don't know that I have the right answer as far as stay on top of it, manage it well, go into it with the right mindset, because you're not going to make one call usually and get it handled. Just realize it's a process.
Well, obviously you have succeeded thus far. So whatever you're doing, it's working to get you here.
Well,
so let's talk a little bit about the people that you've helped through your talks and through whether it's personal mentorship. Just let's dig into that a little bit more. How has that looked for you, and like what are some of the types of people's situations that you've been able to help through your sharing your own experience?
That's been the biggest reward of all this to me, is being able to help others, right? And there's multiple stories, but I can tell you a few that really, I am involved with the organ association. So there are times, in fact, I just got a call not long ago, a couple nights ago that uh, the organ procurement teams and things of that they have my number, and when they are in the hospital and there is a family that's trying to make a decision on donating their loved ones organs, and the family asks for, maybe more, they need, more, they need to talk to somebody, or they do reach out to me, and I've had several of those call me. I've had friends that just know somebody that's in that situation and give them my number to call me. So but I mean, that's always a tough call, because I mean, they're sitting in the hospital with someone that has been their loved one that has been pronounced dead. Maybe they still have brain life, and so they are a candidate for an organ donation, and they're debating on, do they do an organ? Should they donate their organs, or should they not? And so I give them a glimpse of, like I said, just a glimpse of hope in the middle of a tragedy, right? Through this bad situation, here's something I can tell them my story. I can tell them, I mean, it's just a hard conversation, but I really listen. But then I share how that organ has saved my life. And so I do get the opportunity, and I love doing that, because I always hope that, they make that choice and that we could save someone's life over here. And then, there's simple stories like, just a couple of weeks ago, I was speaking I had a public speaking event that I was at, and I was talking to this group, and I could see this lady over on my left side that was just really struggling through my story, and so afterwards she was hanging around, and I was talking to people, so I finally got over to visit with her, and she says, I have a son that really needs to hear your story. She said, I wish you'd have been here today. She said, I'm struggling with him just having hope. He's he's really not wanting to, he doesn't want to go to class. He's a senior in high school. He doesn't even want to go see people. He wants to stay in his room and play games, and he just doesn't want to deal with anybody. And he has no hope. And she said, your hope, really, your encouragement, and all these things you've been through, and still have a positive outlook. I need him to see that. And so we were just talking about it through it. And I said, well, and I was an hour and a half from where I live. And I said, I may ask, what party, or where are you guys from? Well, they happen to live like 15 minutes from where I live. And I said, would you mind? I mean, I'll be glad to go, have a Coke or a sandwich or something with your son, if you'd be, if that would work. She, absolutely. So I was able to do that. And I tell you, that was probably a bigger reward for me. He and I really clicked, and it was amazing. It was amazing lunch. But to me, that's what it's about, right? If I can connect with somebody and help them through those stories, because you never know. He had nothing to do with transplants or organ donation. He struggled with life. He had a wall in front of him that he just felt like was bigger than he could climb. And we just talked. I mean, we just had a good conversation about hope, and I mean, what are some of the things you want to do? You're talking about college. What do you want to do when you grow up? I mean, I just got into conversation. Before you knew it, this guy, he talked my ear off, and I loved it. But that's, to me, those are some things that, and again, I hope people are sharing their story, because I held back for so long, my story. And now, just to think that I've been able to help people through mine, and everybody that has a story can help. And everybody does have a story. You never know what the person next to you, or your coworker, or the person that the waitress at the restaurant, you never know what they're going through. And sometimes that door just opens to share a story that really may help. And so I encourage people to be ready to be armed to help share stories, because you never know what somebody's going through and where you can help them.
It reminds me of something, a friend of mine who's been on the show multiple times, David Bartley, who's a suicide survivor turned mental health advocate and a TED Talk speaker. He works a lot with military, that sort of thing. And he has a quote, and I hope I remember it correctly, but it goes along the lines of, connection builds hope, and hope saves lives. And what you're doing with that young man, and what you're doing in sharing your story with people, it saves lives through building hope with connection. And connecting someone, especially when you're talking about someone who's dealing with a family member who's in a tragic situation, and they are having to make a decision. And what you're doing in that moment is you're giving them an idea. There is light at the end of the tunnel for this, even if it's not the light that you hope to see, even if it's the fact that some good can come from this tragedy. It doesn't take away from the fact that there's a tragedy, but there is hope on the other side of it. There's a quote from an author that I love as well, who is name's Brandon Sanderson. He's a science fiction fantasy author. He does a lot of his characters have a lot of mental health struggles, and he does a lot of advocacy through that. And one of the characters struggles with depression. There's a quote that who was helping that character shared with him, and I found it very impactful. And it's that right now the day is dark and everything sucks. Essentially, I'm totally misquoting it, but
Yes, sir.
there's one thing that is true, and that it's the sun will shine again. It may not be today, it may not be tomorrow, but one day the sun will shine again. And
So
sometimes that's
true.
all you need to know. Whether it's you going through the tragedy or whether it's someone you love going through it. It may not be today, it may not be tomorrow, but someday the sun will shine again.
So true. I love that. I love that. I mean, it's very true. But you know, sometimes that hole is so deep for some people that maybe they can't see through that. And that's where people need to put an arm around somebody. And that's why I encourage, don't do like I did don't dust off and just keep going and not tell anybody. Keep share your story. You never know when you'll reach that person that just in the right time.
So let's dream a little bit. Let's talk about the situation that you went through and the good that may come of it in the future as a result of the work that you're doing and sharing with organ donation and building a mindset of hope. If I may paraphrase again, there's a lot of people who are working through all sorts of things, like you mentioned earlier. Everyone's going through something, and whether or not we share it. But if people were able to adopt this mindset, and this is both for patients and providers alike, providers go through stuff too, and they go through it in a different way because they go through 100 people dealing with something and they carry that. And versus it's a little bit different burden for the patient who's going through it themselves, and it's a lot more acute versus very diffuse, but it's still there. And so I want to dream a little bit of what is the possibility of this mindset if it were adopted across everyone who's struggling with something in the US, struggling with complex illness, or providers who are dealing with people every day who are struggling, who are dealing with tragedy or dealing with chronic or complex illnesses. What could change? Say everyone was able to hear this episode today, and 10 years from now, what would it look like for the patients, for the providers? What would it look like for people going through stuff if they were to adopt this method of hope?
Wow. I mean, what a great thought, right? I mean, that you talk about dream, and that's you're right. As I was talking earlier, let's visualize that for a minute, right? Let's look at that and what that looks like. Man, I love that visual because I mean, to me, the impact that this would have on people that we don't even know that needs to hear it, right? I mean, it's obvious the people that are in the hospitals that need help, but there are so many people, just like you mentioned a while ago. I mean, I spoke just recently to a athletic football team coaches and administrators, and what I didn't realize through that, and I'm gonna get back to the answer to your question, but what I didn't realize, I didn't think these people are pouring into kids every day. They're trying their best, you know, to pour into kids, make sure that they're with all the new laws and what they can and can't do, and all this within with schools and they're pouring into these kids, but nobody's pouring into them, and they need as much help as the kids do. And so what I envision here, Brett, would be to reach those people that we don't even know need help. Right? You talked about medical, the staff and the medical assistants. All those people are dealing with all these things every day. They need. I mean, if we could put our arm around them, they need somebody to talk to. They need people to talk. And if it was just us locking arms, if I can just, I keep envisioning people just kind of grabbing arms and wrap and just helping each other with whatever they're dealing with. That would be an amazing thing to see. But it's not unlikely. I mean, if we're out there, quit being, having to be the man, take that man suit off for a minute and be a helper, and be somebody that can listen and be somebody that can give. Don't just be somebody that you're not just, you also can receive help. So, man, that's a beautiful vision, Brett. But I just hope that to me would be, think about it. I mean, if we gave people hope is one of the things so many people are missing in this world. I mean, hope, I could put hope as the number one thing right now in our I mean, you put it in our government, put it in our school systems, put it wherever you want to put it. Hope is the number one thing I think we're lacking. And if we could spread the word of hope, and people like you and I and the audience, I'll go grab a handful of people and go give them some hope. You could see this thing just be a contagious chain of a domino effect that will be a positive. Because we talk about that 1% again. If we could get 1% going across multipliers, think about what the difference that makes, right? So that's a beautiful thing to me. And I'm going to visualize that again, Brett. I think you just gave me a vision that I want to continue to look at. So that was awesome. That's a great picture.
And that's one of the things about hope is one, it's so universal, the impact, and it's so ubiquitous, the need, that it is, I personally, I may be biased because this is kind of tends to be where I focus on helping people, but it's the number one need in my mind. And something that a lot of people that I've heard tend to talk about is like the idea of the phrase of like these days or whatever, these days are crazy, or things are going to hell in a handbasket, whatever the terminology people use when they look at, the government these days. And people tend to have this mindset that I've seen of things are really bad now. And for me, it's the fear mentality of things are on the edge of collapse right now. And I'm not saying that's not true, but guess what's also true? It's always been that way.
Yeah, that's true. That's very
The world has always been on the edge of collapse, but the people who build the future, the people who take it back from the edge of collapse are the people who have hope.
Right.
So if you want to build the future, if you want to make a difference in a world that looks like it's going to hell in a handbasket, looks like it's on the edge of collapse, then be a person of hope. Don't keep pushing it towards the edge. Your body will follow your eyes. Society will follow your eyes. The impact that you have is either pushing society towards or away from collapse. And it comes down to whether or not you have hope or despair, whether you predict there is a possible future that is good, or whether you predict that it's all bad and there's nothing we can do about it. You yourself are making an impact and pushing it further or away from that edge. And so it is the number one thing, no matter where you are, whether you're in a first world country and you're worried about where you're going to get your next latte, or whether you are in a third world country and worried about where you're going to get your next meal. Like those are, regardless, hope defines us.
It's so true. And, I would say this is hope. With that being said, whether it's in the country of getting the latte or looking for your next drink of water, we all have the tool to make that change, right? And I go back to that again. It cost us it's up to us. It is up to us. It's up to you. It's up to me. I mean, I've got a picture right here. There's a picture over here of a mirror, and it reminds me. That's my reminder that it's up to me. I got to look in that mirror right there. It's a picture of it, just showing a mirror. It's not a real mirror, but it's a picture that is just showing. It reminds me. It's up to me, and it's up to you, the audience, whoever, to make that decision. Whether it's to make a change in your career, or in your business, or in your spiritual relationship, whatever that looks like. It's up to you to make that choice. And when you start dreaming and visualizing it and taking those small steps, man, it's amazing what we could do. And you're right. People like us are the ones that are going to have to take us off of that edge of collapse, but it's up to us.
So if you had just one thing to share, if you could boil it down to one thing that you were sharing for the people, whether it's the patients, the practitioners, or everyday people who are struggling and need that dose of practical hope, if you had one thing that you could share with them, 30 seconds in an elevator, what would you share?
Life is short. Decisions are up to us. And find your why and keep hope. That's what I would say. Just the other thing would just be, I'm an open book, tygipson.com. I would love, if there's any questions out of your audience, if there's anybody that this really connected with, I'd love, my cell phone is on that website. Call me. I really am, I'm here to help in any way, any form. If there's if there's anybody looking for a motive, with facts and real life, I've talked to sales teams. I've talked to anybody about just pushing through adversity. And again, just as I've talked about that one kid that I was able to help out that audience. If that person's out there, I want to help them. So please, my contact's there, reach out, and I'd be glad to do that.
All right. Awesome. And we'll make sure to put your contact info in the description. I love it. Ty, this has been a really powerful conversation. Obviously, it's near and dear to my heart because I believe it's the most powerful conversation that could be had, regardless of where you are. But I think it will be impactful for anyone listening, regardless of where they are on the spectrum of their needs. And I just want to thank you. Thank you for your perseverance. Thank you for your hope, because your hope is not only a gift to you, it's a gift to the world because of what you've been able to share with it and the hope that you've been able to give other people. So thank you for doing that. And then thank you for taking the time to come on here and share that with our audience today.
Right. Thank you. And thank you for what you're doing, because you're making an impact. And thank you again, as I said earlier, for y'all's service to our country. I appreciate that.
Thanks for joining us today. Be sure to check out our next episode here and use the comments to ask any questions or suggest any future topics. If this episode was helpful to you and you want to support our mission to improve U.S. healthcare and win the war on complex illness, you can donate any amount using the following QR code or the link in the description. As always, like, subscribe, and share this episode with someone who would benefit from it. See you next time.